Welcome to Lifestyle Matters. I'm Marilyn Moore. Today we have Dao Moua, who is an orthoptist at IQ Vision Care in Clovis. And this is a very special, unique niche position that she has here. And I don't know really anything about it, so I'm excited to learn more. So let's welcome Dao to the show. Welcome to the show.
Thank you.
Now, like I said, this is a very unique position that I've never heard about. So why don't you explain what an orthoptist is?
An orthoptist is a physician extender. According to the American Medical Association, we are categorized just like a nurse practitioner. And so what we do is we work exclusively with ophthalmologists, especially the subspecialties of neural and pediatric ophthalmology. We help to detect any binocular vision defects, any eye misalignment known as strabismus. We also help to manage and treat diplopia and amblyopia.
Okay, so those are some very big terms for me. I'm not sure if other people know what those mean. Can you just, dissect a little bit? I think all eye movement disorders, correct?
Mm-hmm. Yes. So amblyopia is where a person favors one eye over the other, and they shut off that eye, and they don't use that eye. So therefore, if they're not using both eyes, they lose depth perception. They lose their binocularity. And diplopia is when they have double vision. So we help manage that either with prisms or, changing glass prescription. And that's what I help the pediatric ophthalmologists with. Orthoptist hasn't been around long. It's here in the United States, it's only been here for 75 years here in the United States. There's currently about 250 of us currently in practice. Because there's only 12 orthoptic programs here nationwide, and they accept only 1 to 2 students a year, that is why there's not many of us.
So it's important that we have you here in the Central Valley. We're privileged.
I'm happy to be here.
Now, how are you diagnosing some of these disorders, or maybe what should we look for, any symptoms?
So for young children, we always look to see if their eyes start crossing or drifting, meaning that the brain is not utilizing both eyes well. When children go in for the wellness exam and they have cool gadgets now, like those vision screening tools, and they'll let us send them to us to see if there's a difference in their prescription, to let us know, hey, check this out. What is going on here? Does this patient need further assessment or not?
Now, like you said, you're one of the few in the United States. So how did you even get into a specialty like this?
At the time, I have a four-year-old niece, and she was diagnosed with exotropia. I have worked in the ophthalmology, and my sister asked me about this condition. I started researching into exotropia and ran across the word orthoptist. So what I found out motivated me career-wise to look further into it and further my knowledge to help out my niece.
Wow, that is amazing. Now, what does a typical day look like for you here?
So a typical day here at IQ with Dr. Derek Holt, the pediatric ophthalmologist I work with, is bringing the child back, having them focus on toys, or pictures or letters if they're old enough, and trying to maintain their fixation there while I assess their alignment by doing what we call a cover-uncover test to see if I see crossing or drifting of the eyes.
Now, I'm sure you just love working here. Mm-hmm. Yeah, because you're dealing with children every day.
Mm-hmm. Yes, I am very grateful that I had the opportunity to come back here when IQ CEO Julie Cleland found out about my acceptance into the orthoptic program in Chicago, Illinois. So I was trained at Anna Robert Lurie Children's Hospital. She and the board were surprised me with financial assistance during my time in the orthoptic program and to help me out while I was out there. And I am so grateful for that, just because it gave me the time to spend time with my family instead of looking for another source of income when I wasn't in school.
IQ is certainly an amazing, amazing company, and thank you so much for your service, what you provide for children and adults. I mean, like I said, we're very privileged.
Thank you so much.
Thank you, Dao, and thank you, viewers, for tuning in. Make sure to check out the website for any more information on her profession and what she can offer you. I'm Marilyn Moore, and you're watching Lifestyle Matters.